Welcome to this presentation focusing on identifying and reporting elder abuse and neglect. Throughout the healthcare arena, elder abuse is also referred to as elder mistreatment or elder maltreatment. For the purpose of this presentation and to provide continuity, the term elder abuse will be used throughout the course of this presentation. It is important to understand how this country defines elder abuse. It goes well beyond many people thinking that physical abuse is the only abuse to assess for in our elderly patients. It is also important for us to be more aware of the signs, that is, the visual cues associated with an elder who may be abused or neglected. Think of what you see besides the bruises and cuts. Also observe an elder's body language and what the elder says, but most important, what they do not say. As healthcare providers, we must be cognizant of the prevalence of elder abuse, know how to report it, and know how to identify it. According to the United States Census Bureau, in 2010, the elderly population of this country was 40.3 million people over the age of 65. This number represents 13% of the total population. By the year 2030, the estimated elderly population is expected to rise to approximately 72.1 million, more than twice the count in the year 2000. This number will account for almost 19% of the total U.S. population. Each year, there are approximately 4 million reported cases of elder abuse and neglect. For each reported case, there are an estimated 13 more that are not detected and/or reported. The quality of life of older individuals who experience abuse and neglect is severely jeopardized, as they often experience worsened functional and financial status, progressive dependency, poor self-related health, feelings of helplessness and loneliness, and increased psychological distress. Research also suggests that older people who have been abused tend to die earlier than those who have not been abused, even in the absence of chronic conditions or life-threatening diseases. Despite popular belief, most incidences of elder abuse and neglect do not happen in nursing homes or residential settings. Most elder abuse and neglect takes place in the home or a private setting where the elder resides. About 95% of older people live on their own, with their spouse, children, siblings, or other relatives, and not in institutional settings. Risk factors associated with elder abuse include those with physical, visual, auditory, or mental or cognitive conditions that significantly impair an elder's ability to care for themselves. Specific forms of abuse will be discussed a bit further in this presentation. Any adult who is 60 years and older is defined as an elder at risk for abuse or neglect. The Centers for Disease Control and Prevention defines elder abuse as any type of abuse or neglect towards someone 60 years and older. The World Health Organization defines it as an act toward an older person that causes harm or distress. You will find that there are several different versions defining elder abuse, but it is essentially acts committed through the infliction of harm or acts of omission through neglect. There are many organizations, committees, and legislation that focus on the issue of elder abuse and neglect. The Older Americans Act was established in 1965 in response to concern by policymakers about a lack of community social services for older individuals. As part of the Patient Protection and Affordable Care Act, the Elder Justice Act was passed into law March of 2010. Some key provisions include the requirement for immediately reporting to law enforcement of any crimes committed in long-term care facilities, and establishes civil monetary penalties for failure to report any of those crimes. Another significant part of this legislation is the inclusion of mandatory and discretionary funding directed toward improving adult protective services, the education of healthcare staff, and training program for state ombudsmen and national organizations, just to name a few. The Senate Committee on Aging focuses on many issues plaguing the elderly, including abuse and neglect, and concentrating on efforts to improve identification and reporting practices. On March 2, 2011, actor Mickey Rooney testified before the committee, and then Chairman Senator Herb Kohl from Wisconsin, stating, "I was eventually and completely stripped of the ability to make even the most basic decisions in my own life. I persisted in sharing with others the abuse I have suffered, and I am now taking steps to right all of the wrongs that were committed against me." The GAO, or the Government Accountability Office, published a report that gave greater attention to elder abuse in the United States, and that it can impose an economic burden to all Americans. It even suggested increasing public expenditures on health care and including a wider range of supportive services for the elderly and their caregivers. There is no typical elder abuse victim. Current research shows that generally, people tend to think elder abuse happens to poor white people with low education and members of minority or ethnic groups. Elder abuse can and does happen to people no matter what their income, education, race, or gender may be. All individuals 60 years of age and older are at risk for being abused or neglected. There are many signs or clues that elder abuse could be occurring. For example, does the elder hesitate to talk openly, appear anxious, or withdraw when certain family members or care providers are around? Performing a general assessment may reveal unusual appearances to an elder's clothing or skin. Assess for unusual nutrition patterns. Does the elder appear malnourished or dehydrated? Some other indicators that abuse may be occurring could include bruises that have multiple colors, multiple sites, fractures of various stages of healing, decubiti, burns. Where are the burns located? Repeated hospitalizations or clinic visits, canceled appointments. It's also important to assess the elder's living environment. Does the elder appear sedated? Are there visible restraints, or is there evidence restraints of some type have been used? Does the elder appear tired? Has their mobility or range of motion changed since you last assessed them? Do they appear depressed or anxious? Detection of elder abuse and neglect can be difficult. The signs of abuse may be subtle and often difficult to identify. Aside from the obvious visual signs, assess the elder and look for less obvious, subtle indicators in their behavior and living environment. Some indicators on the following slide may not be obvious evidence of abuse, but they are clues that something out of the ordinary or unusual may be occurring. Again, a thorough and accurate assessment is key. Time spent observing and assessing interactions between the elder and caregiver or private discussions with the elder can aid in this process. Any discussions should not include others, especially the care provider. Identification and prevention is vital in suspected cases of elder abuse or neglect. Remember, your assessments should go well beyond the typical physical assessment, especially if you suspect or someone else suspects that abuse is occurring. Elder abuse generally falls into the following categories. Any elder experiencing any one of these following elements is a victim of elder abuse and/or neglect. We will discuss each of these forms of abuse and neglect over the next few slides. Physical abuse is defined as the intentional use of physical force that may result in bodily injury, physical pain, or temporary and/or physical impairment. Physical abuse accounts for greater than 25% of all elder abuse cases. It may involve any of the indicators on this slide. Physical abuse of elders tends to escalate over time, especially when the elder is frail and cannot care for themselves and their functional status is declining. Evidence of physical abuse may not always be visible to others or healthcare providers. Signs or clues that may indicate physical abuse are some behavioral changes, including the elder seems uncomfortable or in pain. They guard parts of their body. They wear long sleeve tops and long pants in hot weather, attempting to hide evidence. A caregiver refusing or delaying access to the elder. in an attempt to try and hide evidence of abuse, or preventing discovery of the abuse by others, or preventing the elder from reporting the abuse. Sexual abuse can range anywhere from just sexual exhibition to rape. Sexual abuse can include inappropriate touching, photographing the elder nude, photographing the elder in suggestive poses, forcing the elder to look at pornographic material or videos, forcing sexual contact, or any unwanted sexualized behavior. A few signs that this may be occurring includes the points on this slide. Sexual abuse includes rape, sodomy, coerced nudity. Sexual abuse is perhaps the most shocking but least reported type of elder abuse. Sad to say, this does occur. Verbal, emotional, and/or psychological abuse can range anywhere from name-calling or giving the elder the silent treatment to intimidating and threatening the elder. When a family member, caregiver, or other individual behaves in a way that causes fear, mental anguish, emotional pain, or distress, that behavior is abusive. Verbal and emotional abuse can include yelling, swearing, making insulting or disrespectful comments to the elder. It is important to remember that as a healthcare provider, never ever refer to an elder as grandma or grandpa, honey or sweetheart, or refer to them by their first name unless you have permission to do so. Otherwise, refer to them by financial abuse or exploitation is the intentional theft and/or misuse of an elder's money or property. As an elder ages, their physical, emotional, cognitive condition decreases, and their vulnerability for financial abuse dramatically increases. Some indicators for financial abuse or exploitation may include some of these bulleted points. Unusual banking activities such as funds missing from bank accounts or unexplained withdrawals, check signatures that do not match the elder's, identity theft, sudden changes to an elder's power of attorney, especially if the caregiver is not a close family or friend. This leads to an increased risk for making legal decisions without the elder's permission or selling items belonging to the elder, including real estate and automobiles. Isolating the elder from family and friends prevents identification of this abuse. This prevents the elder from reporting the abuse to others. Financial abuse can also include the theft of personal items such as jewelry, antiques, blank checks and credit cards, and collectibles, to name a few. Abandonment is the physical desertion of an elder by an individual who has custody or has an assumed responsibility for providing care for that elder, or by a person having physical custody of that elder. It can be active or intentional, or passive, unintentional, based on factors such as ignorance or denial that the elderly person needs as much care as he or she does. Abandonment is typically committed by an individual who has physical custody of the elder, or by an individual who has assumed responsibility for providing care to that elder. Neglect is the refusal or failure to fulfill any part of a person's obligations or duties to an elder. Neglect includes acts of commission and/or omission on the part of the responsible person and includes failure to provide a healthy and nurturing environment. This includes failure to provide basic needs such as safety, food, clothing, shelter, and essential healthcare services. It is important to assess for possible indicators, and some may include the elder's physical state. Do they appear well nourished and hydrated? What about normal bowel and voiding patterns? If there are catheters and colostomy bags, are they clean and do they fit properly? Does the elder report having no caregiver or being left alone at times? What is the condition of the elder's environment? Is their clothing in good repair and is it clean? Do they have necessary and appropriate clothing depending on the climate, especially female undergarments? Does the elder keep medical and dental appointments? In providing your assessment, it's important to check their oral condition, such as teeth and dentures and the oral mucosa. When healthcare providers have knowledge of any of the above and do not report it, that alone is neglect. Self-neglect occurs when an elder fails to provide themselves with the basic necessities of life, including food, water, shelter, clothing, hygiene, and medical and dental care. Self-neglect occurs when an elder cannot care for themselves based on cognitive or physical disabilities, and there is little to no oversight of their care. Self-neglect can occur with elders who are financially, cognitively, and physically able to care for themselves. This is especially so if there is some form of abuse occurring. Self-neglect is the most prevalent form of abuse there is and accounts for 40 to 50% of all reported cases of elder abuse. Earlier, I mentioned a few risk factors for elder abuse. Identifying risk factors is paramount for an elder's safety and well-being. Factors contributing to elder abuse are complex and often related to the victim, perpetrator, and social context of the situation. The number one risk factor for elder abuse is caregiver stress. Cognitive and/or physical impairment of an elder is another risk factor, since they may not be able to assist with ADLs or communicate effectively. This often leads to their inability to report the abuse or defend themselves. It also contributes to caregiver stress because there is more work involved on the part of the caregiver. As an elder's health declines, especially in elders with terminal or chronic diseases or conditions, the risk of abuse rises dramatically. At times, there is little to no support system for the caregiver, thus increasing stress levels. Assessing your elderly patient and their caregiver in the clinical setting is important, but in settings outside the clinical setting, it is also important to assess for any possible caregiver stress. The abuser controls the elder through intimidation and threats. Threats to withhold nutrition and medicine. Threats to harm the elder or the elder's loved ones. If the abuser is a family member or loved one, they use that relationship to their advantage, often making the elder feel guilty, such as that the abuse was the fault of the elder, making the elder reluctant to report the abuse or to seek help. The abuser, especially if they are a family member, may be continuing the cycle of family violence. The elder themselves may have been abusers in the past and have abused the caregiver. No matter what the situation is, you have an obligation to report that abuse, even if it is only suspected. Numerous research studies have shown that male adult children are the primary perpetrators of elder abuse, even though male and female both abuse. The majority of elder abuse occurs in private settings where the elder resides and not in long-term care settings. There are some prominent characteristics of individuals who commit elder abuse. For example, when someone visits or tries to visit the elder, or the elder is at an appointment, the abuser will try to limit the conversation between the elder and another individual. They are trying to control the interaction in an attempt to hide the abuse and prevent the elder from telling someone or reporting the abuse. The abuser will not adhere to the prescribed plan of care in an attempt to control the situation. They may not want the elder to improve or get better. The abuser may have a past history of drug and/or alcohol abuse, or a past history of committing abuse or was abused themselves, thus continuing the cycle of abuse. You may hear reports of abuse from others. Perhaps they suspect that a caregiver is abusing the elder. These alleged instances should always be taken seriously and reported to Adult Protective Services. It is your obligation. The elder's spouse often commits the abuse, but it's the male adult children of the elders who are the primary perpetrators of elder abuse, no matter where the elder resides. Remember, caregiver stress is the #1 trigger for committing elder abuse. The adult child may resent having to care for the parent. They are dealing with issues of their own, such as financial concerns, issues with their employment, marital problems, or issues with their own children. These issues are compounded as the elder becomes more frail and there are gradual declines in physical and mental status of the elder. If you suspect or identify that abuse is occurring or has occurred, it is vital that you gather as much objective data and information as possible. Depending on the type of abuse evident or suspected, you will assess one or more of the following, including the elder's physical condition, the elder's emotional state, their living environment. You're going to gather victim and/or witness statements. Also statements and explanations from alleged abusers if possible. Remember, your accurate assessments and documentation is your best evidence. Do a thorough assessment of skin integrity. Look for obvious signs of trauma, especially in places not normally visible, such as under clothing or on the scalp. Assess the elder's physical hygiene. Are they clean? How do they smell? Check for bruising or discoloration, then accurately document the color, size, and location. Are any marks patterned? Are they persistently in the same spots? Check the oral health, teeth, dentures, mucosa, and tongue. Are any cuts or skin tears visible? These should be measured and documented along with the stages of healing and the elder's or caregiver's account of how it happened. Check for bite marks, ligature marks, and document location as well as the elder and/or caregiver's account as to how it occurred. If there are any noted injuries, it is important to be as specific as possible and include names or titles such as lacerations, abrasions, tear, burn, blister, or puncture, not just injury. Are there any fractures? Were they previously addressed? Document location and how it may have occurred. Check genitalia, both in male and female, for any injuries or the presence of an STD or persistent urinary tract infections. Always measure and document decubiti. Does your elderly patient or client appear fearful, anxious, depressed, experience any sudden mood changes, and/or withdrawals from normal activities? If so, the chance that some type of abuse is occurring is very high. It is important to determine if any of the above symptoms have been ongoing or are something new you may have observed or something new reported to you. Many patients have conditions or diagnoses such as depression and/or dementia of some type, and this may contribute to any of the mentioned symptoms. But no matter the situation, always determine whether they have been ongoing for some time or are new indicators, as some type of abuse may be a distinct possibility. In investigating suspected abuse, clues throughout the elder's living environment may offer a great deal of evidence to confirm or rule out abuse. Assess the cleanliness. Assess whether floors are clear, free of obstructions. Is the bedding clean? What about their clothing? Is it dirty and in disrepair? Does the elder have access to adequate nutrition and hydration? Do they have access to regular mail, internet, or email, or telephone? Does the elder or care provider limit your access to certain areas of their living environment? All of the above may indicate some type of abuse is occurring and warrants further investigation and reporting to Adult Protective Services. Always accurately document what you see and/or hear. In performing your assessments if you suspect elder abuse or neglect, here are a few assessment tools that are often used. The Brief Abuse Screen for the Elderly is a 5-item instrument that assesses for the likelihood of abuse. The Caregiver Abuse Screen is an 8-item instrument used if you want to assess for abusive caregivers. The Elder Assessment Instrument has 44 items to help trained nurses identify elders who are at high risk for abuse and/or neglect and who need to be referred for further assessment. And finally, the Elder Abuse Suspicion Index includes 6 items, 5 questions, and 1 observation. This is administered to the elder and it assesses for the likelihood of abuse. Feel free to incorporate any of these tools in your assessments, and even perhaps you can develop one of your own. If you notice any physical, emotional, or environmental indicators of abuse, it is important to talk to the elder and ask them specific questions such as, does anyone ever threaten, yell at them, hit or slap them? Have they ever been denied food or hydration, and if so, by who? Have they ever been forced to have sex? This is with both male and female elders. Were they ever asked to sign documents they didn't understand? Does someone control or limit their access to money and bank accounts? Do they have any missing property or personal items? Are they left alone, and if so, how often and for how long? Are they afraid of anyone, and determine who they are afraid of, such as a spouse, adult child, family friend, or healthcare provider? It's important to note that any time you conduct an interview, it must be done in private and away from the person in question. Document exactly what they tell you. Never ad lib or put it in your own words. If the elder refuses or is reluctant to answer your questions and you suspect abuse or neglect, immediately report it to Adult Protective Services. When you suspect abuse or determine that an elder is indeed experiencing some type of abuse or neglect, you must contact your local Adult Protective Services agency. Be sure to have exact, objective data and information documented, such as wound measurements, when and how they occurred, and who inflicted the injury. Include an elder's weight, especially if there are concerns about nutrition and hydration. Accurately and objectively document the elder's emotional state. Are they crying? What are they saying? How are they acting? Accurately and objectively document their environment. What does it look like? How does it smell? Exactly document victim statements. Exact answers to all of your questions. Do not ad lib. Put it in quotes if you have to. Exact statements from any witnesses and, if possible, the suspected perpetrator. If the care provider refuses or limits access to the elder, or the elder refuses to answer questions, immediately contact your Adult Protective Services agency. Every state has specific legislation pertaining to reporting elder abuse and neglect. It differs from state to state, so as a healthcare provider, it is your professional responsibility to know exactly what those laws are. In addition to state regulations, your agency or healthcare organization may have their own reporting protocol in place, so you need to familiarize yourself with those as well. When you do see evidence of abuse or neglect, or actually witness it, the very first thing you do is to make sure you are safe. Remove yourself from immediate danger. Then, if you or the elder is in imminent danger, you dial 911 immediately. If not in imminent danger, then report the abuse or neglect to your local Adult Protective Services agency. The first thing everyone needs to do is make a list of the important contact numbers, especially if your work involves the elderly population. Everyone providing direct patient care or services is required to report elder abuse. Almost 95% of reported cases of elder abuse come from police and emergency responders, and less than 2% of those reported cases come from physicians and primary care providers. For every 1 case of reported elder abuse, at least 13 go unreported. You are required to report abuse if you have direct evidence, suspect abuse is occurring, the elder reports it to you, or someone else has reported it to you. Again, one cannot stress enough the importance of reporting elder abuse and neglect. Remember, laws vary from state to state, so you need to know what those laws are where you practice. In state licensed or regulated facilities, anyone working there is required to report abuse or neglect, everyone from the administrator to maintenance staff and everyone in between. If you intend to file a report, you do so according to your state and agency protocol, most likely to your local Adult Protective Services agency. When you do file a report, be as objective as you possibly can, state exactly what you saw or heard. Even if you heard secondhand information, report it exactly as it was told to you. Elder abuse is significantly underreported. Regarding physicians, nurses, and other healthcare providers, they simply do not know how to report the abuse or neglect. Often they don't recognize the signs of abuse other than obvious physical signs. Or they don't want to jeopardize the physician-patient or nurse-patient relationship. That relationship is so strong, the provider may often feel that in reporting the abuse or neglect, the elder may stop seeking healthcare services altogether. As far as other care providers go, they don't report it because they don't know how to report it. They don't want to get involved. They don't know if they're supposed to report it. They don't recognize or know about abuse and neglect other than physical, thinking that if they don't see something, the elder is fine. Regarding the elder themselves, they don't want to disturb or upset the family unit. There is often fear of retribution. Often this is the reason why elders themselves do not report the abuse or neglect. They are embarrassed, or they are ashamed that they are allowing the abuse to occur. They feel that it's their fault. There are a number of local, state, and federal agencies in place to assist in reporting and investigating elder abuse. The National Center on Elder Abuse is a resource for public and private agencies, healthcare professionals, service providers, and any individual interested in elder abuse prevention information, training, technical assistance, or research. Adult Protective Services, or APS, is present in all 50 states and is designated to receive and investigate allegations of elder abuse and neglect. Each state has a primary agency that houses APS. It may be the Area Agency on Aging, the Division of Aging, the Department of Aging, or the Department of Social Services. Again, it is your responsibility to know what it is where you will be practicing. This is your go-to source when reporting elder abuse or neglect, so it is important to know your local phone number. Area Agencies on Aging provide support for older adults, their families, and caregivers through advocacy, information, and services. Programs and services offered for vulnerable older adults vary by locality, but often include a long-term care ombudsman and an elder abuse prevention specialist. Elder Care Locator is a nationwide service sponsored by the U.S. Administration on Aging that connects older Americans and their care providers with information on senior services. If you know the address and zip code of an older person being abused or neglected, the Elder Care Locator can refer you to the appropriate agency in that area to report the suspected abuse or neglect. This agency is particularly helpful if caregiver stress is an issue. Each state attorney general's office is required by federal law to have a Medicaid fraud control unit that investigates and prosecutes Medicaid provider fraud as well as patient abuse and neglect in healthcare programs and home health services participating in Medicaid. Contact information for individual state MFCUs is available online. The National Domestic Violence Hotline is a toll-free anonymous hotline providing support counseling for victims of domestic violence and links more than 4,000 local support services for individuals abused across the United States. It is operating 24 hours a day, every day of the year. There are countless sites and presentations throughout the Internet that discuss identifying and reporting elder abuse and neglect. Many of them are similar in content and all offer great information. The site specifically mentioned on this slide is probably the most comprehensive one I have viewed. I provided the link, so go ahead and view it. It is a class that requires a registration which only takes less than a minute to complete, and it's free. It does have a pre and post test with 15 questions each, but you don't necessarily have to complete them to view the presentation. If you do both tests and view the presentation, you will be provided with a certificate of completion. I know you will find the site valuable. It is every healthcare provider's professional and ethical responsibility to protect the elderly because, as people age, there is increased risk for them to become victims of elder abuse and/or neglect. The safety and well-being of elders is paramount, so healthcare providers must prioritize the care they provide to elders in order to ensure their optimal quality of life. Healthcare providers who care for the elderly must become more involved in public policy that addresses elder abuse and neglect. Whether an elder lives in a home setting or somewhere within a healthcare system, healthcare providers play integral roles in an elder's life. Each healthcare provider must take a proactive stance in combating elder abuse and neglect by contacting and educating their state and federal legislators, urging them to support and fund any legislation that seeks to address elder abuse and neglect and supports the health and well-being of our nation's elders. The takeaway from this presentation has 3 key concepts. First, familiarize yourself with the various types of abuse. Aside from obvious physical abuse, many cases of abuse go unreported because healthcare providers and/or other individuals do not know that it is occurring. Second, look for the signs. How is the elder acting? What is the elder saying? Especially what they are not saying. What is the condition of their environment? What is the elder's appearance? Finally, above all, know your state's reporting practices. Always have those contact numbers available.